Hello, everyone. My name is Monica Prieto, and this is a journal assignment for Politics 1133. The topic I decided to address today is the healthcare access issue in Texas. And despite there being a lot of very persuading topics on the list that we could have picked, I truly believe that healthcare access is the number one issue that we must address now. Why is this of importance, and why should it be the one we prioritize? Well, first, health is the single most important thing. It's the thing that allows us to be able to do our jobs, to go to school, to function overall as a society. Without health, society wouldn't be able to work as it should. Now, another thing is the lack of awareness of how proper timing and access to quality care actually makes an immense difference in patient outcome. And unfortunately, a lot of the horrific outcomes can be prevented if people do get access to this care despite their economic status or location. And overall, it should be important to Texas because it talks about an improved quality of life. So that would just make it a way more attractive state to live in and build a family. Now, while I'm focusing this presentation on Texas, healthcare access is not only the most important issue for Texas, but it should be the most important issue for the world. Now, specifically in Texas, what are the core challenges that we're facing currently? Well, I added two different quotes from two different sources. The first one reads as Texas has the worst uninsured rate in the US once again, and this was taken in 2025. So, yes, one of the core challenges we're facing is how big the gap is from insured population to uninsured population and how that deeply affects how these people um, have access or get treated in all of the different facilities. Now, talking about facilities, it leads me to the second core challenge, which is a lot of hospital clinic closures. And the quote is from 2021, but it reads as 28% of counties in Texas have no hospital. And most of these counties, as you probably thought, yes, they're in rural areas, and these people have to drive hours to get access to quality care. And it does make a huge impact on their health and their outcomes when facing a difficult situation with their bodies. Now, these are some graphics that I got to prove my point on uninsured population. As you can see, I highlighted Texas, and as of 2024, around 16.7% of the population is uninsured. That is almost 1/5 of the population of Texas is uninsured, and it just talks highly about how this state or overall we value this topic. Now, in the second one, it's more visual and it just compares all the states with their uninsured rate as of 2024. And as you can see, there are states that go as little as 5.5% of the population being uninsured, but Texas is definitely one of the higher ones, and that is why I think not only should the country be trying to improve this aspect of healthcare access, but Texas should be definitely looking like one of the primary states to be looking at into this. Now, the second graphics I gained are for clinical shortages. The first one it shows all the red dots shows all the closures, and the gradient or the different colors represent uninsured populations. And as you can see, it goes up to 40%. So in some counties, around 40% of people are uninsured. In the other graphic, we see hospital closures from 2005 to 2021, and an exception to one, Texas doubles the amount of every other state that we at least doubles the amount of every other state listed here. So that just speaks highly of how crucial it is to face this problem or tackle this problem as of now. So how would I propose to do that? Well, there's two main solutions. First of all, more personnel, so improved conditions of healthcare workers, not only economic wise, but also in the environment they're in when working to help them make the most efficient decisions and get the better care for their patients and expand opportunities for them. This one is more targeted to the young population that wants to go into healthcare but doesn't have the access to the resources that would provide them the education for that. So through scholarships or housing, they would be able to complete their studies and eventually help tackle the lack of personnel problem in Texas. The other solution I have is invest in coverage. So not only invest in free clinics in both rural and urban areas. I listed both rural and urban because of population densities and how even in urban areas, even though we do have a lot of hospitals, um, there isn't enough to cover everyone. But the other one is increased insurance investment for the general public, for example, Medicaid. One of the sources I read actually listed that most people that aren't insured are actually able or like qualifiable to get Medicaid, but they just don't have access to it. Now, what could we face with these solutions? Like, what criticism could we face? Well, there's two main ones: cost concerns by taxpayers, the state government, and federal government. And the second one is government support, or specifically lack of government support. So how would I face this? Well, first, I would make it known how there would be a lot of jobs made and how they would have an increased the population would have increased opportunities, and overall the economy they or the money they invest in will come back to their communities, so they will not only see the first time improvement on all these facilities and all of this access to care, but they will see it in their quality of life. The second one is to make it known how the difference between preventative care and long-term care, specifically how it is so different cost wise, and how we could be saving billions of dollars actually if the patients went before the condition worsened, and how that makes all of that better. And even though the primary investment would be more eventually in long term time, we would get a reimbursement of that investment. Now, I thought about this a lot and how what data could actually make me switch my proposals or my ideas, and this is the one I came up with. And it is that evidence, the only way I could change my thoughts is evidence that the private market alone could achieve similar coverage and quality of care, and most importantly, affordability. So if the private market would be able to provide all these things and be accessible to all the patients that need it, I think that would make me re-question all the solutions that I proposed previously. But yes, overall, healthcare should be our priority, and with the help of everyone, I think we would be able to solve or actually decrease the amount of uninsured people by a substantial amount in a short term range. But yes, thank you so much. I hope you enjoyed my presentation.